So what are some common issues in the menstrual cycle? This is what we can talk about. So Mittelschmerz, mid-cycle pain, painful and heavy periods, premenstrual symptoms, and the more severe version, premenstrual dysphoric disorder, and then how we manage that and when people should come and see medical. So Mittelschmerz, as you may recall from our first session, ovulation occurs around about day 14 of a 28-day cycle. It's when the egg is released from the ovary into the fallopian tube. This can cause some Mittelschmerz, mid-cycle pain. This might be a very vague, very mild pain, right through to a very severe pain that interferes with people's day-to-day life. Usually we don't need to do anything about it, but there are things we can do, for example, safely interfering with the natural cycle with some hormonal methods. As you might recall from our first session, a normal period is considered up to around 80 ml of blood. We know that anything more than that can be abnormal. Soaking through a pad or a tampon every hour for 2 or more hours can be dangerous. Passing clots that are around a coin size or bigger, they should certainly come to see medical. Because what can happen is they can get low iron, they can get iron deficiency anemia, they can start feeling faint or lightheaded, it can start interfering with their day-to-day work and social activities, they can bleed through clothes and bedding, they might need to be doubling up on protection. All of these things are flags that they might be bleeding too much and we need to intervene. What can cause that? It could just be their natural cycle. It could be something like fibroids, which are benign growths within the uterus. They increase effectively the surface area of the endometrium, the lining of the womb, so that there's more to shed. The copper IUD and other forms of contraception can contribute to heavier periods. People can be on blood thinning medications, or people can have a pelvic infection, which I'll speak to in a later slide. So things to think about as well. If we're training in a pool, not everyone is comfortable swimming when they have their period. Not everyone, for cultural reasons or anything else, might be comfortable using internal devices like a tampon or a cup. And thinking about the availability of period products as well if you're out in the field or doing any exercises away from toilet facilities. Dysmenorrhea is what we mean when we say painful periods. People can feel cramps in their lower abdomen. It can spread around to the back. It can vary between each cycle. It can vary between people. Some questions that I might ask to gauge whether their cycle or their pain is within the realms of normal might be, is simple pain relief like Panadol and ibuprofen, is that working? Are you able to go about your normal day-to-day activities? Is sleep affected? Anything like that, then certainly they should come and see medical so we can help them out. If someone has abdominal pain when they're not expecting their period, it's really important that they see a medical professional quickly to, one, exclude an unplanned pregnancy, particularly an ectopic pregnancy, which is a pregnancy outside of the womb, and that can be incredibly dangerous because it can rupture and cause a lot of blood loss. And the second issue is with a pelvic infection. So I'll just speak briefly to this, but it's just something important to be aware of. So PID, or pelvic inflammatory disease, is effectively an infection around the womb or the ovaries. It's sometimes, but not always, caused by sexually transmitted infections, STIs. There are lots of other bugs that can contribute to it. Symptoms you usually present with some abdominal pain. Like I said, around outside of the time you would expect your normal menstrual cramps. There might be different discharge. Dyspareunia is pain during sex, postcoital bleeding, so after sex, bleeding in between their periods, feeling feverish or systemically unwell. As you can see, the potential consequences, we've got ectopic pregnancy, which we've touched on, infertility, an ovarian abscess, which may require surgery, and chronic pelvic pain. The potential sequelae are quite significant, so it's really not one that we want to miss. So premenstrual symptoms. This is due to just the changes in hormones and the brain chemicals. It can be affected by things like lifestyle factors and any hereditary factors. It can occur anywhere between 5 and 11 days before the period. So if someone is having 11 days of premenstrual symptoms and then 7 days of a period that really only gives them around 10 normal days per month, which can be quite miserable. These symptoms can be anywhere from mild to very severe. You can see kind of a range here, but emotional side effects, you can see some mood swings, irritability, food cravings, difficulty falling asleep, changes in libido. You can get your physical changes. We've spoken about cramps and backaches. You can get bloating, muscle or joint pain, sore breasts, and then PMDD, premenstrual dysphoric disorder, is effectively a much more severe form of this. This can be to the extent even where mood changes are so significant we're getting suicidal ideation. So it's really an important one to know about. So how do we manage difficult periods? Non-medication, we know that reducing caffeine, regular meals, regular exercise is all very helpful. There may be some benefit from things like acupuncture and yoga as well. And then medication-wise, of course, they'll probably be coming to see medical at this point, but we can look at different anti-inflammatories and timing them at different times of the cycle. We can look at contraceptives or other hormonal medications to safely interfere with their natural cycle. And sometimes even antidepressants like SSRIs, selective serotonin reuptake inhibitors, that can be taken at some days during the month or daily to help with these symptoms as well. So lastly, when should people refer to medical? We've spoken about the frequency, so if someone is having varying cycles by more than a few days per month, we would want to see them. If it's lasting longer than 7 days per month, we would want to see them and make sure they're not losing too much blood and iron. And lastly, the flow, which we've spoken about. And on the left, you can kind of see some rough examples of some menstrual cups. So that's what we're talking about when we say about 80 ml.